what is the main cause of hypertension? Unfortunately, the main reason for hypertension nowadays is our lifestyle. Hello there, it's Dr. AskDrBhat here. I'm a nephrologist in Bangalore. Today, I'm going to answer most frequently asked questions regarding hypertension in my OPD. The most popular one that I get asked is how to reduce hypertension. Now, hypertension is a lifestyle disease. The way to begin is to change our lifestyle. When I say lifestyle, it includes diet, exercise, sleep, and recreation. And in each one of them, I would say quality, quantity, and timing is important. The second question I've got here is, what is the main cause of hypertension? Unfortunately, the main reason for hypertension nowadays is our lifestyle. 40% of Indians, adult Indians, are hypertensive now, and 50% of Americans are hypertensive. So we do not have much to close the gap, really. And India is the capital of hypertension in the world just because we are the capital of population in the world. We have the highest number of population for any country in the world. So we have got a huge number of hypertensive people. That's because our lifestyle has changed drastically in the last 100 years. The way we used to eat 100 years ago, the amount of physical activity we used to do, our stress levels, everything has changed. And that's why we are more hypertensive. Then there are a few genetic factors where there is familial hypertension, but they are all very, very small. When we do not have any cause for hypertension, we call it as primary hypertension, and we assume that all this is because of lifestyle changes. When it comes to secondary hypertension, the most common is the kidneys. So people could be having some primary problem in the kidney like glomerulonephritis, or a problem with the blood vessel supplying the kidney called renal artery stenosis that could be leading to hypertension. The next most common is hormonal issues. On top of the kidney, there is a gland called the suprarenal gland or the adrenal gland, which is a very active gland, produces multiple hormones, and one of them is called aldosterone. Kidneys produce a hormone called renin. So if somebody has got increased renin production, that leads to increased aldosterone production and hypertension. There are situations where renin is normal, but then the adrenal gland itself produces aldosterone by itself, and that's called primary hyperaldosteronism that causes hypertension. Hardly 5% of the young and then less than 2% of the elderly turn out to be having secondary hypertension. Majority of us have primary hypertension. That is because of lifestyle changes. The third question I've got here is, what are the 5 signs of hypertension? I suspect this will be signs and symptoms because symptoms are something that we experience. Signs are something that the doctor elicits. So I would say signs or symptoms of hypertension: headache, blur of vision, bleeding from the nose, anxiety or palpitations of the heart, chest discomfort or chest pain. I would say these are the most common signs or symptoms of hypertension, but these are all late. Early on, when somebody has got hypertension, they are asymptomatic. Majority of the times they are asymptomatic. Very few people develop hypertension quickly over a matter of few days or weeks, and there is usually some other cause for that. Most of us, it's lifestyle induced, so it develops very slowly and goes up slowly. So by the time we develop any symptoms, we probably would have had hypertension for many, many years. So unless you check your blood pressure regularly, even though you're asymptomatic, and repeatedly check it, you will not pick up hypertension. And if you wait for symptoms to develop, it will probably be already late because there's already target organ damage by the time you develop symptoms. But when I say target organ damage, any changes to the brain, the eyes, the heart, the kidneys, these are all target organs for blood pressure, high blood pressure related injury to the organs. Now, the fourth question that I have is, can you live a normal life with hypertension? Yes, of course. Even if you're not diagnosed with hypertension, even if you're diagnosed and you don't get it treated, since you don't have any symptoms, you can lead a normal life, but then it will not be normal for long. If you want a normal and a long, healthy life, you need to diagnose and effectively treat hypertension early on. So, screen your blood pressure regularly, and then even though you're feeling normal, make sure that you don't ignore it. Just because you feel all right, your blood pressure is 150 by 100 or something, but you feel all right, don't ignore it. Don't give excuses and ignore it. Check it again and again. If it's regularly, if it's consistently high, see a doctor, take advice, start lifestyle changes. It will take some time for the lifestyle changes to have their effect, but then you might have to start some medicines to lower the blood pressure down so that target organs are protected. So yes, you can have a normal life, but then if you want it to be long, control the blood pressure. By hook or crook, I would say, preferably by lifestyle changes, but don't avoid medications. Now, the fifth question I've got here is, what is normal blood pressure by age? I'll take this opportunity to address age, sex, or based on our work, what should be the blood pressure? The blood pressure does go up as we grow older. Young people, children, have very low blood pressure. And there's a nomogram based on the age, height, weight, and the sex as to what should be the upper limit of blood pressure for children. But anybody who is over the age of 16, not even 18, over the age of 16, it's all standardized. And different associations have different, criteria for diagnosing and classifying hypertension. Kids have a low blood pressure, and as we grow older, our blood pressure starts going up. Young people, the systolic doesn't go up too much. It's the diastolic. When we have young people with hypertension, it's the diastolic which goes up rather than the systolic. But as we grow older, the systolic keeps going up and the diastolic keeps going down. And in elderly, it's something called as isolated hypertension. For adults, normal blood pressure should be less than 130 by 80. I've got another question about stages of hypertension. I talk about the various stages of hypertension in that one. But less than 130 by 80 should be normal for adults. But for young women, they should be having a much lower blood pressure. For athletes, for people who are doing hard physical labor, their blood pressure should be much lower. That's because when they exercise, blood pressure goes up, heart rate goes up. So their resting blood pressure is very, very low. Athletes' blood pressure might be 100 systolic. A young woman's blood pressure could be 100 systolic. When athletes exercise, their blood pressure goes up, heart rate goes up as well. That is how, we can reduce our blood pressure by very good, consistent exercise. The resting blood pressure goes down. And when we exercise, it does go up. For elderly, previously we used to accept 100 plus age as the upper limit of normal. So somebody who is, say, 60, we would say systolic blood pressure of 160 is normal. For somebody who's 80, systolic blood pressure 180 is normal. But nowadays, we have realized that that is not true. So even for the elderly, blood pressure of less than 140 systolic is better as compared to 150 or 160 if they can tolerate it. Some people, some elderly cannot tolerate it. So we have to accept a slightly higher blood pressure. If they can tolerate a lower blood pressure, less than 140, we don't want a very tight control in elderly, less than 140, it's much better for them. They are much better protected from strokes and heart attacks and kidney failure. Now coming to the sixth question here, what are the 4 stages of hypertension? Different associations, different bodies have got different criteria for diagnosing and staging hypertension. But for us in India, probably what is applicable is the International Society of Hypertension, because it looks at both the developed countries and the developing countries. In developed countries, they've got much stricter criteria because they want to reduce the rate of heart attacks and strokes and heart failures and kidney failures. But in developing countries, we have to be realistic. Not many people can access healthcare. So we should be having slightly relaxed criteria. However, that doesn't stop you from trying to achieve the best. So if you want to have the best blood pressure, you should go with the American Hypertension Society guidelines, or ACC, American College of Cardiology guidelines, which says that normal blood pressure is less than 120 by 80. There are 4 categories: normal blood pressure, then high normal or elevated blood pressure, where systolic blood pressure is between 120 to 129 and diastolic is still less than 80. Then they've got stage 1 hypertension when systolic is between 130 to 139 and diastolic is 80 to 89. Then stage 2 when blood pressure is more than 140 over 90 millimeters of mercury. However, the International Society of Hypertension says normal blood pressure is less than 130 by 85. In American Society, it says less than 120 by 80. Here it is 130, 85. High normal is when blood pressure is 130 to 139 systolic and 85 to 89 diastolic. Then instead of stage, here they've got a grade. Grade 1 hypertension is when systolic is between 140 to 159 and diastolic is between 90 to 99. And then the last one, which is grade 2, when systolic is more than 160 and diastolic more than 100. This is what we tend to follow in India because it's International Society of Hypertension guidelines and the Indian Society of Hypertension has just adopted that. So when somebody has got grade 2 hypertension, we do not wait for lifestyle changes. We start medicines and then we advise them lifestyle changes and then we can chop and change the medicines as the blood pressure goes on with the lifestyle changes. I would say even when there is grade 1 hypertension by the ISH guidelines, we should start medicines and then start the lifestyle changes concurrently. But when there is high normal blood pressure, that is a time where we don't need blood pressure medications. We start with lifestyle changes and then keep monitoring the blood pressure. Coming to the 7th question now, what food reduces blood pressure? I think we addressed it in the first question already, but just to recap, food that is very high in fiber, food that is very high in potassium, magnesium, low in salt, high in low fat milk products, milk and milk products. These are the food that have been found to reduce blood pressure. And then the frequency of taking food as well. You just spread it out. Don't keep snacking all the time. You have food maybe 2 times or 3 times in a day and then make sure there's a longer gap between the night dinner and then the morning breakfast. So try to have your dinner a bit earlier, not at 9, 10 o'clock. Maybe have it at 7 o'clock or earlier than that. And then you have your breakfast after 8 o'clock in the morning. So there's a good 12, 13 hour gap. So that helps reduce the insulin spikes and then the blood pressure as well. The 8th question I've got here, how do you control blood pressure naturally? And once again, this one we've already addressed in the first question, the lifestyle changes. So it is a combination of changing our diet, exercising better, sleeping better, and relaxation, recreation. All the 4 are important. Which drink is good for blood pressure? I'm not a big fan of juices because I always feel that it takes away the fiber, which as I've told before, is probably the most important nutrient which is actually not absorbed, which helps control the blood pressure, the sugar, our weight, our bowel. There's a huge importance nowadays given to our bowel health. Bacterial content in our bowel has got a huge role to play in our mental health, our cardiovascular health, our kidney health, everything. And more fiber is a good raw material for the good bacteria in our gut. A lot of fiber, it slows down the absorption of sugar, slows down traps the cholesterol in the bile, so reduces the cholesterol in the blood as well. So it has got huge amount of benefits. So don't take too much of juice, but then if you insist, I would say beetroot, pomegranate, tomato and green tea is supposed to be helpful with lowering the blood pressure. Beetroot has got a lot of nitrates that lowers the blood pressure. Green tea has got catechins which are supposed to lower the blood pressure. Make sure you consult your doctor with regards to how frequently you have to monitor the blood pressure, etc. Because I usually tell my patients if it is controlled, you don't have to check it every day. So these were the questions that I found to be very common in my OPD and I tried to address it. I hope it's helpful for you. We've also included a BP monitoring chart in the link below and you can download it, print it out and use it to record your blood pressures at home as well. Thank you very much.